Radio 94.3. It is now 7:10 on the clock. Welcome to the second hour of the After Shift. You are still with RJ Trish, and of course, as I have been mentioning earlier in my first hour, we are having our another episode of The Doctor is In, and tonight I am very, very happy to be joined by Dr. Aref Awa, head of ENT department of Ahli Hospital. Yes, so hi, Doc.
Good evening.
Good evening, Dr. Aref. How are you?
I'm fine, thank you. How are you?
I am good.
Good.
I'm actually excited for our discussion for tonight.
It is excited.
Yes, and well, Doc Aref is the ENT consultant and head of otolaryngology and head and neck department at Ahli Hospital.
That's
and he has over 20 years of experience in otolaryngology, head and neck surgery, and rhinoplasty.
Indeed.
Yes.
Indeed.
I am really, just to share with you, Qabayan, I'm excited to interview Doc Aref because he says this is easy peasy for him. And
Lemon squeezy.
yes, lemon squeezy. So for tonight, we are going to focus on hearing loss. That is going to be our main topic for tonight. But first things first, Doc Aref, what is ENT and what do otolaryngologists do?
ENT is abbreviation for ear, nose, and throat. So basically, we are treating all diseases that is related to ears, nose, and throat. As an ENT surgeon, we are treating a wide range of diseases.
Yes.
We're doing wide range of surgeries, and of course we are clinician at the end of the day.
Yes.
So this is what we do as ENT. Otolaryngology is in Latin.
It's basically ENT.
Exactly. It's otorhinolaryngology. Oto, ear, rhino, nose, and larynx is laryngology.
Yeah. Ooh, okay. And Doc, you've already discussed what ENT is, and I can only imagine how wide range of the patients or the problems that these patients experience. But as we have said, as I have mentioned, we're here to focus on hearing loss. So what do we need to know about hearing loss? Because there might be many other problems, many other ENT problems or ear problems at that. But what is hearing loss? How do you characterize hearing loss, and who are mostly experiencing hearing loss?
Hearing loss is when we are losing some of or most of our hearing at some frequencies. As we know, the speech frequencies is 2, 3, and 4,000 kilohertz. So when we are having this reduction in hearing on those frequencies, we will have some hearing loss. Hearing loss can be divided into two parts. Something related to the outer and middle ear, and something related to the inner ear.
Okay.
The outer and middle ear, we call it conductive hearing loss. It means that the sounds that comes to us, they don't reach the nerve, which calls the cochlear nerve. If the problem in the cochlear nerve or in the inner ear, that calls sensory neural hearing loss. So it's neural.
Okay.
It's not something that we can see or we can treat. We will talk about this later.
Yes.
So we will see how things will go. Who are more prospective to get hearing loss? People who are exposed to loud music, exposed to loud noises. Sometimes we will have hearing loss from as a child. Sometimes we will have hearing loss because of middle ear infection or outer ear infection. Sometimes we do have hearing loss because of diseases in the bones of the middle ear, which is the malleus, incus, and stapes. So the variety of hearing loss is really wide. We need to see and assess each patient individually.
Okay. And Doc, what are, well, you have already mentioned sometimes it can be in children.
Absolutely.
Yeah. So what are the causes of hearing loss? Is it something that you acquire genetically or not?
That's what we can divide hearing loss in children into two parts: congenital, which is a born not hearing, or acquired, which is due to a diseases.
Okay.
Congenital, when a child come with like Pierre-Robin disease, like other diseases, it means that the problem is in the middle and inner ear. While acquired hearing loss is mostly because of a diseases of the middle ear. Children can have it mainly between the age of 0 and 5 or 6, and the most
So as young as that.
absolutely.
Yeah.
And the most of children between this age is due to what we call otitis media with effusion. So it's the water gets into the middle ear and it prevents the movements of the tympanic membrane and the ossicles, and that causes hearing loss.
Oh, okay. So just the simple, when water comes in your ear, that could be dangerous.
No.
Oh,
it's
it's
not,
different.
Absolutely. It's all related to what we call eustachian tube. Eustachian tube in children is more horizontal. In adults is vertical. Otitis media with effusion is one of those diseases that due to eustachian tube dysfunction.
Okay.
So let water get into your middle ear. It's fine. Wash it.
It will come out?
Normally, absolutely, it will come out.
Yes.
Because the middle ear is a sealed room.
Ah, it's sealed.
It's
Okay.
sealed. It's not opened. The tympanic membrane is our door. It's always closed.
Okay.
Unless we will have a hole in our tympanic membrane, then we will have diseases and the water will come out, and it's totally different from children.
Yeah.
Otitis media with effusion.
Okay. So let's take note of that. It's different from when you take a bath or when you go swimming.
No, just do it.
Yes.
Just keep doing it.
Yes. And Doc, what are the symptoms? Like, how would you know that you're already probably on the verge of having hearing loss? Is there such thing as symptoms when it comes to hearing loss?
Yes. People will shout to you, you don't answer. Children, you will call them, they don't react to you. They will put the volume on the TV or radio high. So at this stage, if it repeated, you need to be concerned and you need to bring him to Al-Ahli hospital.
To Al-Ali Hospital. I love that, yes.
To get him
Bring them
checked.
to you.
Absolutely.
Yes.
To get him checked.
Okay.
We need to do hearing test. This is the bottom line. Anybody who is having hearing loss, for the reasons that I mentioned, he has to have a hearing test.
Yeah, they have to be tested. So, Doc, you've already mentioned about the test. So, what if the patient turns out to have hearing loss? Can they regain it?
Excellent question. The hearing loss, as I mentioned, we can divide it into two parts.
Yes.
The first part is conductive hearing loss, which is related to outer ear canal and middle ear. And the other side is when it goes into the middle ear, into the inner ear, which is nerve related.
Okay.
If anything in between the outer ear canal and the middle ear, yes, we can regain it. Inner ear hearing loss, which is cochlear, let's say it, palsy, or the nerve is not working, which is most likely to be congenital due to a disease that like measles or any symptoms, then yes, it's not regained. Though we do now have what we call the cochlear implant.
Cochlear implant?
Yes, which you can even successfully regain the hearing even if the cochlear nerve is, let's say, dead.
Ooh.
Yeah.
Okay, so when you say implant,
Yes.
oh, okay, so that's it. Like it's self-explanatory. Like Implant. That's what it is.
Absolutely.
So you can like regain it even if the
Even if the cochlear nerve is gone,
Is
it's
dead.
dead,
Okay.
it's not reacting to noises.
okay.
Of course, it's not like the normal ear.
Mm-hmm.
So it's an implant. It has two parts, one inside the skull, one outside the skull. It's a
Yes.
very long talk about it, if we will, maybe in the future. But for the middle ear and outer ear diseases, yes, we can get the hearing back.
Okay. So, Doc, are there other ways to treat hearing loss? Like, what are the cases, or when do you need to undergo surgery? Is there such thing as
Yes.
that for hearing
So,
loss?
let's concentrate on the conductive hearing loss. When we have conductive hearing loss, it means that noise is not going from outside to our ossicles in the middle ear.
Yeah.
That means that we have a problem in the outer ear canal,
Yeah.
which means that there is some stenosis or there is some infection. This is easily treated with some antibiotics and some medications that we usually
Because
give.
it's just an infection.
Absolutely. Let's go now further to the middle ear. When we are talking about the middle ear, I told you it's like a sealed room with one door that opens and closes that calls eustachian tube. So we need to find out what is the main reason of the hearing loss. Is it tympanic membrane perforation? Is it middle ear effusion, water in the middle ear? Is it something what we call eustachian tube dysfunction? Is it the ossicles themselves they have got exhausted? Or is it a disease in the actual bone, which that calls mastoid, which behind our ear? That's when we will confirm
Yeah.
what is the cause. For those part, yes, we will have, we need to do surgery
Okay.
for this.
And Doc, we have a question here. What happens in the hearing test? Like, how do you do it?
Yes, hearing test is usually an audiologist who is doing it. It's sitting in a room like this, which is sealed also from outer noises.
So it's soundproof.
It's soundproof.
Okay.
There is a special machine that we will give again headphones, and we will give our patients or our guest signals, noises, and he has to press a button when he will hear these noises, and then it will be recorded, and according to this record it will show us whether the patients have a hearing loss or not.
Oh, okay.
It's easy test that we can do.
Okay, so to anybody who is feeling like the symptoms that you have mentioned, it's important for them to go for a hearing test because it's easy
Absolutely.
and it's quick.
It's quick,
Yeah.
easy, and effective.
And Doc, what are the primary care problems in both children and adults? How can we better take care of ourselves in the context of ENT or just in the ears or hearing loss?
First thing, I will advise everybody to avoid loud noises, because loud noises they are really hurting our nerve. Secondly, you need to, there is normal care of the hearing. The most important thing is just avoid loud noises. And if there is, now every child from born, we do something, the examination called autoacoustic emission. This will give us indication on, yes, the child is hearing. This is from birth. It's after 2 or 3 days
Yes.
after birth, we will do this examination. And then we will repeat it after 6 months.
Oh.
So this will give us a clear indication whether there is any problem with the hearing, whether it's that the child is okay. Hearing loss problems is really let's say, common and not common. Common in adults and children because of adults and elderlies. Less common in children.
Okay.
Unless we have an infection of the middle ear.
For
So-
the children.
For the children. So avoid loud noises.
Yeah.
Bottom line.
Yes. And so what about us, Doc? The headphones. So just not too loud.
Not too loud.
Okay.
Exactly, not too loud. Just keep it on the normal level that it won't pain your ear.
Okay.
Anything paining the ear is bad.
There is, I don't know if this is real, but growing up, my parents have always reminded me not to do too much cleaning on my ear.
100%. Don't do cleaning to the ears. Come to us, we will clean
Oh,
your ears.
really?
When we are using cotton buds,
Uh-huh.
we are pushing the wax inside.
Oh.
We are pushing it towards the tympanic membrane. Plus, we are damaging our ear canal.
Okay.
So, ear have a self-cleaning mechanism. It clean itself.
Okay.
After shower, just a towel on your finger, tilt your
just the
head,
outer
and
part?
exactly, and it will clean itself. There is people who will have more wax accumulation than others. Those people has to come to ENT doctors just for ear cleanings every now and again.
Okay, so we can also do that in Al Ali?
Absolutely.
Yes.
Of course. Of
Yes.
course.
So I just really had to ask that question because it's always a reminder, especially for kids who just like to play with the cotton buds. So thank you for that, Doc.
Thank you. And tell children not to use it at all, because how many patients we've seen with remaining of cotton
Yes.
or
It just makes it
stuff.
worse.
Exactly.
Yeah.
Exactly.
So, and some people even do ear cleaning by
By the-
using cotton buds every day. So that's
very,
worse.
very, very bad.
Okay. So it's a
Don't,
good thing that we
please.
learned that
Don't.
today. And Doc, what are the latest updates in hearing loss management?
The latest, actually, it's not updates. It's just something that has been going on now for the last 10 to 12 years, which is a cochlear implant, as I mentioned.
Yes.
Plus, we have now something that the hearing aids are now very sufficient, very efficient, and very small. There's a lot of people who have hearing loss due to various reasons, but they don't want to put the hearing aid because it's too big or it's too ugly. Now the hearing aids are very small. They go inside the ear canal, non-noticeable, very efficient, and they transfer the voice very nice.
Oh.
Plus, the other thing is implantable hearing aids, which goes inside your
Implantable.
implantable hearing aid.
That's
which goes
interesting.
inside the middle ear.
So
Those implantable hearing aids are a little bit more costly.
yeah.
Plus, you can't use them on a wide range of people. So it's selective,
Okay.
okay? And the cochlear implant, of course, if we have the sensorineural hearing loss.
Okay. So thank you for that,
You are
Doc.
welcome.
And well, since we're talking about all these hearing loss management and Al Ali Hospital, so what facilities does Al Ali Hospital have for hearing loss patients? Can they just go to you?
Of course,
Doc?
of course, they are more than welcome to come anytime. We do, as I told you, we are one of the biggest hospital in the country. We have hearing test, we have children hearing test, we have this what we call the APR, which is the one that we do for children who are not very cooperative, that we can put them asleep. So come and see for yourself.
Yes,
You will
and
be happy.
come to Doc Aref.
Sure.
He'll be there for you. And yes, for my last question, how often do we need to have our ears checked, Doc?
Once a year.
At least once a year. That's
For
important.
hearing, no, let me put it rightly.
Okay.
For hearing tests, you don't need to do it unless you start to feel that you have a
Like
problem.
the symptoms.
Exactly. But for routine, casual checkup,
Yes.
once a year, for check your ears, is it clean, is it not? If they are not, we can clean them. Apart from that, no, it's fine. Ears is a very sensitive and a very important organ.
Yes.
At the same time, it's very durable. It's very durable.
So, well, Doc, what if you feel or you hear ringing in your ears?
That's what we call tinnitus. Tinnitus have a wide range of tinnitus, whether it's a high tone tinnitus or low tone tinnitus. Again, tinnitus is mainly accompanied by a hearing loss.
Okay.
You can't have tinnitus. You remember when we were young and we were going to discos, when you come back, you will hear the sound in your ears. And this is what is called tinnitus. It's a reflection of the big, massive music
Yeah.
thingy that you will still have it in your ear, but this goes after a day or after a few hours, while tinnitus will stay with you for a long time. That's why when whoever have tinnitus, he has to come and check his ears, check his hearing mainly, because tinnitus always accompanied by a hearing loss.
Okay. And well, Doc, we've already discussed all about hearing loss, at least the basics.
Yes.
So, do you have any final words, final reminders for our listeners right now?
Just please take care of your ears, take care of your hearing. Don't use cotton buds. Any hearing problems,
Yes.
check it. Plenty of places to check your best place is our hospital,
Ahli
Hospital. And thank you for getting me here.
Yes, thank you so much, Dr.
you.
Aref. And of course, thank you so much to Ahli Hospital.
Thank you.
Is there anybody that you want to greet?
Well, I'm going to
That's
greet
my biggest
all-
question.
Yes, all the nurses at Ahli Hospital. Everybody. They are an excellent team. We have an excellent team, and we have an excellent, really, people around us.
That's
working.
for
Without
sure.
them, we can't do it.
Yeah, so no specific names.
Everybody
Because
will
they might get
angry.
mad at you. So,
Thank you.
a big shout out to all the staff, all the nurses of Ahli Hospital, Doc Aref's colleagues as well. So, thank you so much, Doc
Thank
Aref.
you
I
so
learned
much.
a lot today. And one of my key takeaways is to not clean my ears.
Absolutely. Come to us. we will
Using
clean it.
cotton buds. So,
Definitely.
thank you so much, Doc Aref. And I am hoping that, well, we'll get to meet again soon. It was such a fun interview with you because,
you.
as you've said, this is just easy peasy.
Lemon squeezy.
Thank you so much,
Thank you so much.
Doc
Thank you.
Aref.
Thank you.
Yes, that mga kabayan is another episode of The Doctor is In. I hope you guys enjoyed as much as I did, and I hope you learned a lot, just like how I did, because ang dami ko din talagang natutunan. O, ayan na. So, kapag maglilinis daw ng tenga, ay magpunta na lang kay, well, sa Ahli and kay Doc Aref. So, thank you so much, Doc. And, yeah, that is it, you guys. It's already 7:34 on the clock, and I'm gonna have to take a very quick break. So, I'm gonna be back later on to play more of your favorite jams, and of course, for our Chica tonight. So, keep sending your messages. I'm gonna be here all the way until 9, and reach out to me at Qabayan943 on all of our social media accounts. This is Trish on the After Shift, only here on Qabayan Radio 94.3.